A man pointing a gun at nurses, visitors, and others at Reedsburg Hospital's ER is unmistakable in the surveillance video. A year after this happened, the ordeal continues to haunt some staff members.
But it's also encouraging other emergency healthcare workers to train for their own life and death situations. Tonight, Tony Galley is digging deeper on how these lifesavers are planning for threats.
This convicted felon, Jeremiah Willie, is pulling a mask over his face in the emergency department of Reedsburg Area Medical Center. This hospital surveillance video also shows he has a gun.
It was seismically dangerous. A number of cell phones were taken by Willie.
This armed man trains his gun on hospital staff members, wants drugs.
We have a shooter. We have a thief. We have a drug seeker.
Incredibly, staff members remain calm. A patient in the ER even tries to de-escalate the situation with a question to Willie.
Are you all right?
This video from the incident in March 2015 goes on for 5 minutes. Staff, patients, visitors, virtual hostages.
He had a scanner on his phone. He could tell that something had been called in, and he got out of there.
In prosecuting Jeremiah Willie, Sauk County Assistant DA Dennis Ryan also tried to help the victims.
What people have now is something they did not hold in the pockets of their scrubs before. Now they have fear.
What played out? Erratic, gun-wielding man among vulnerable patients, staff.
These nurses are our friends. We train together, we work together.
Strikes fear into the hearts of other healthcare workers as well.
It's a fear. It's a real fear, and we're prepared for it as best we can.
Emergency departments in cities the size of Madison typically have access to security personnel, even police officers. Not the case in a rural setting. In Reedsburg and some other smaller hospitals, there's compensation for that with training on escaping violent encounters.
The course is a non-aggressive course, so we're teaching the participants self-defense, ways to get out of situations. Just pull and hit your chest.
We always deal with people that are at crisis points in their lives.
Prairie du Sac Hospital ER Director Lisa Picartz and her staff took EMT trainer Josh Kowalski's course. So did the emergency department at Reedsburg, just weeks before the video captured this threat.
I saw how it was handled at the Reedsburg ER, which was phenomenal.
Remain calm under the pressure. We're talking about ER nurses, so they do have a lot of pressure, and they're normally calm under that. But this is a little bit different situation when their life is being threatened.
We all have personal security alarms where they're called a duress button.
In Prairie du Sac, a nurse's button push prompts a 911 call.
Institutions are at risk now. Hospitals, schools.
Technology, building design can help safeguard an emergency department. Prosecutor Ryan believes healthcare professionals are the best line of defense.
It's not how do we block the door, because you can't do that. It's what do we do once it's here.
Inside Reedsburg's ER, the threat was as real as it gets. The response, a lifesaver. Tony Galley, 27 News.
Now, we requested the hospital surveillance video of that incident 15 months ago, but it was only released now after Jeremiah Willie was convicted of recklessly endangering safety and sentenced to 12 years in prison.
While no staff member from that night was willing to relive those moments for an interview, a Reedsburg Hospital spokesperson says they are extremely proud of their professionalism.